Have you ever felt something unusual in your body? A small shift that didn't seem serious, yet lingered in the back of your mind? One of my patients once told me a story I will never forget. She said she had eaten what she believed was a perfectly normal meal, something she had enjoyed for years, and went to bed feeling fine. The next morning, her head felt heavy, her balance was off, and her words came slower than usual. I want you to imagine this. You wake up ready to start your day, unaware that something as simple as yesterday's dinner may have pushed your blood pressure into dangerous territory without you realizing it. Nighttime is supposed to bring healing. It is when the body rests, when the heart slows, and when the brain has a chance to recover from the stresses of the day. But the truth is that for many older adults, the quiet hours of night reveal risks that often stay hidden during the day. Sodium, a daily habit most people hardly think about, becomes one of the most silent threats. It slips into meals, snacks, sauces, and packaged foods so easily that we barely notice it. Yet every extra pinch adds pressure to the bloodstream, making the heart work harder and forcing delicate arteries in the brain to endure more strain than they were built for. The shocking truth is that everyday sodium is strongly linked to rising stroke risks, especially for those over 55. Sodium pulls more fluid into the blood vessels, raising pressure and stiffening artery walls. Over time, circulation becomes unstable, and the brain becomes vulnerable to sudden changes. Many seniors dismiss the early signs because they seem harmless. A little dizziness, a mild headache, a brief moment of weakness in the morning. But these subtle clues often carry a message the body is begging us not to ignore. After decades caring for older adults, I've seen how quiet these warning signs can be until it's too late. Today, we're going to uncover the hidden salt threats that silently raise stroke risks and the simple steps you can take to protect yourself. And if this message resonates with you, please subscribe, like, and share Senior Health Daily so we can continue supporting our senior community. In the next part, we'll dive deeper into how sodium affects your brain, your blood pressure, and your long-term health. How everyday sodium quietly raises stroke risks. Most people never imagine that something as ordinary as salt could slowly reshape the way their heart and brain function. Sodium is part of daily life, woven into meals, snacks, condiments, and even foods that do not taste salty at all. It is so familiar that we barely give it a thought, but inside the body, sodium behaves like a force that quietly pushes the bloodstream harder and harder against the walls of delicate vessels. When someone consumes more sodium than the body can comfortably handle, the extra sodium begins to pull water into the bloodstream. The moment that happens, blood volume increases and pressure begins to climb. Over time, this pressure can cause blood vessels to stiffen. The arteries leading to the brain, which are meant to be flexible and responsive, begin to lose their ability to expand and contract smoothly. Imagine a garden hose that becomes rigid after years under the sun. When pressure surges, that hose can crack or burst. The same principle applies to the human vascular system. As arteries stiffen, the brain becomes more vulnerable to small fluctuations in pressure. A meal high in sodium might seem harmless to a younger adult, but for someone over 60, it can be the tipping point. I have cared for seniors who believed their diets were perfectly normal. They ate sandwiches, soups, and restaurant meals without realizing how much sodium hid inside every serving. One patient told me she rarely used the salt shaker and assumed her intake was low. But her blood pressure numbers continued rising despite her efforts. When we reviewed her meals together, she was shocked to learn that her everyday choices were quietly raising her stroke risks. Bread, deli meats, canned soup, and even the sauces she loved contained far more sodium than she knew. The danger was not loud or dramatic. It was slow, silent, and persistent. Because sodium infiltrates so many parts of the modern diet, many seniors assume their consumption is moderate. But the truth is that even foods that do not taste salty can carry a heavy sodium load. A single serving of canned soup, a slice of pizza, a piece of cheese, or a simple sandwich may provide more sodium than the body can comfortably process in a day. This gradual overload is one of the most overlooked contributors to stroke risks. Why high-sodium diets are especially dangerous after age 55. As the body ages, arteries naturally lose some of their elasticity. It becomes harder for them to absorb sudden changes in pressure. They stiffen slightly with each passing decade, and small deposits of plaque may begin to form along the vessel walls. When sodium enters this picture, it accelerates the aging process. High-sodium diets promote inflammation inside the vessels and encourage plaque buildup. Even small spikes in sodium can become more dangerous because the vessels no longer adapt quickly. There is also a phenomenon called the morning surge. Blood pressure often rises naturally as the body transitions from sleep to wakefulness. In younger people, this surge is manageable because their arteries respond easily. But in older adults, especially those who consumed a salty dinner the night before, the morning surge can become a dangerous spike. The brain, already vulnerable during the early hours of the day, must suddenly cope with increased pressure it is not prepared for. A pattern I have seen countless times in my practice is the combination of several risk factors occurring around the same time. Seniors may eat a salty meal, drink too little water, sleep poorly, and wake up with a sharp rise in blood pressure. Many also struggle with sleep apnea, which reduces oxygen levels during the night. When these factors overlap, they create the perfect storm for stroke risks. A patient once told me she felt strangely tired the morning after a restaurant dinner. She thought she had just slept poorly. Hours later, she developed weakness in her right arm. Her sodium intake from the night before had contributed to a pressure surge her arteries could no longer handle. The truth is that aging does not make the body fragile. It makes it more honest. It reveals the effects of long-term habits in ways that were invisible at younger ages. High-sodium diets that seemed harmless at 40 can become truly dangerous at 60 because the body no longer has the same buffer of resilience. Recognizing this shift is not about fear. It is about empowerment. It helps older adults make choices that support the heart and brain rather than strain them. Hidden salt threats in everyday foods. Most seniors know to avoid obvious salty foods like chips or salted nuts. But the real danger often comes from foods that appear innocent. Packaged meals, canned soups, sauces, dressings, breads, and even breakfast items can contain shocking amounts of sodium. Restaurant meals, especially those eaten outside the home, remain one of the biggest sources. A single bowl of soup at a restaurant may contain more than an entire day's recommended sodium intake. One of my patients believed her diet was exceptionally healthy. She ate salads, lean meats, soups, and whole grain bread. But when we looked closely, we discovered that her salad dressings, canned soups, and whole grain bread were all loaded with sodium. Even foods labeled as heart-healthy or low-fat can contain significant sodium to improve flavor. Over time, these hidden sources add up. People often underestimate the sodium in foods that have been processed for convenience. Items like deli meats, frozen dinners, seasoned rice mixes, vegetable juices, and canned beans often contain more sodium than anyone expects. The problem is not the occasional serving. It is the cumulative effect of eating these foods day after day. Long-term intake of what someone considers normal can slowly increase stroke risks because the body becomes trapped in a cycle of elevated blood pressure and chronic vessel stress. Sodium's impact is subtle. It does not cause immediate pain or discomfort. Instead, it quietly changes the environment inside the bloodstream. It encourages inflammation that makes vessel walls more rigid. It invites plaque to settle and build. It makes the heart work just a little harder day after day, until one day the system can no longer maintain balance. Stroke warning signs seniors ignore. The body does not remain silent when it struggles. It whispers first. It sends small signals that something is off. Unfortunately, many seniors misinterpret these early clues as normal aging. Mild dizziness when standing up, a headache that seems to come from nowhere, or tingling that fades after a few minutes, can all be early warnings of circulation issues. The brain communicates through electric signals. When blood flow becomes unstable, even for a moment, those signals may falter. Morning weakness is another warning sign often ignored. A patient once told me she felt her hand was unusually weak when she tried to lift her coffee mug, but the feeling resolved quickly, so she brushed it aside. Days later, she experienced a more serious event. Vision blurs that last for a few moments, even if they correct themselves, can indicate temporary disruptions in the blood vessels feeding the visual centers of the brain. Trouble speaking, even for a brief moment, should never be dismissed. When the brain cannot coordinate speech properly, it means the areas responsible for communication are under stress. Many seniors find excuses for these symptoms. They believe they slept poorly, were dehydrated, or got up too quickly. Sometimes that is true, but sometimes these are micro-warnings that the brain is signaling distress. Recognizing these small signs leads to faster treatment and can prevent a major stroke. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you. The sodium and stroke connection. Explained simply, understanding the link between sodium and strokes begins with how sodium influences blood pressure. When sodium levels rise in the bloodstream, the body holds on to more water. This increases the amount of fluid inside blood vessels and creates extra pressure against vessel walls. When this pressure becomes chronic, it forces the vessels to adapt in ways they are not designed to. Over time, the vessel walls thicken, stiffen, and become less flexible. These changes raise the risk of clot formation. When blood flow becomes turbulent or slowed by stiff vessels, clots can form more easily. A clot that lodges in a vessel leading to the brain can block blood flow and trigger an ischemic stroke. High-sodium diets also increase inflammation inside the vessels. Chronic inflammation damages the inner lining of arteries, making them more likely to rupture or attract plaque. When plaque cracks or breaks apart, pieces can drift into the brain's circulation and cause sudden blockages. Mini-strokes, known as transient ischemic attacks or TIAS, are early alarm bells. They may cause temporary weakness, confusion, or vision changes, but often resolve within minutes. Many people ignore them because they feel better shortly afterward. But a TIA is not a harmless event. It is a clear sign that something is disrupting blood flow to the brain. When someone with chronic high sodium intake experiences a TIA, it often means the vessels have reached a critical point. Without intervention, a major stroke may follow. The relationship between sodium and stroke is not theoretical. It is practical, observable, and deeply impactful. Countless studies have shown that reducing sodium intake lowers blood pressure and significantly reduces stroke risks. This is especially true for older adults whose vessels have already been exposed to decades of wear. What happens inside the aging brain? The brain depends on a constant supply of oxygen and nutrients. Unlike muscles, it cannot store energy for later use. It needs steady blood flow at every moment. As people age, however, the vessels that nourish the brain become less efficient. They lose flexibility and may develop small blockages that were never noticed. When sodium enters this equation, it further stresses an already delicate system. Reduced oxygen delivery becomes more pronounced. If vessels cannot expand when needed, the brain may struggle during moments of increased demand. Poor vascular flexibility means that even small changes in pressure or flow can disrupt communication between brain cells. Seniors often experience mild forgetfulness or moments of mental fog when blood flow fluctuates. These moments feel harmless, but they are reminders that the brain is sensitive to changes in circulation. The aging brain becomes more vulnerable to sodium spikes than younger bodies. A salty meal that seems harmless at dinner can create significant pressure changes by morning. Older vessels cannot adjust quickly enough to protect the brain. This is why seniors often experience dizziness or weakness after salty meals. The brain is simply responding to the stress placed on its vessels. The key message here is that aging is not the enemy. Hidden habits and unrecognized risk factors are the true challenge. When you understand what is happening inside the brain, you gain the power to support it. Sodium reduction is not about restriction. It is about protection. It is about giving the brain the environment it needs to thrive. Sodium, sleep, and nighttime stroke risks. Nighttime is when the body slows down and the brain enters a state of repair. But for seniors with high sodium intake, nighttime can become a period of vulnerability. Sleep apnea, dehydration, and nighttime blood pressure changes all interact with sodium to magnify risks. When someone consumes a salty dinner, the body holds on to extra water. This increases blood pressure throughout the night. For seniors who also snore or experience sleep apnea, oxygen levels may drop repeatedly. When these drops coincide with high blood pressure, the vessels in the brain endure significant stress. A patient once told me she woke up from a dream feeling confused. She thought she had just slept poorly. Later that day, she developed numbness on one side of her face. The salty meal from the night before had contributed to a pressure surge her aging vessels could not manage. During sleep, circulation naturally slows. This is normal. But when sodium levels are high, slower circulation can cause even more problems. The vessels may not be able to deliver enough oxygen to brain cells. This combination makes nighttime one of the most dangerous periods for stroke risks. Seniors who wake up feeling unusually tired, confused, or weak may be experiencing early signs of nighttime vascular stress. The relationship between sodium and sleep is often overlooked. But understanding this connection is crucial for anyone looking to protect their health. A simple shift in evening meals can dramatically improve the body's stability during sleep. Practical ways to lower stroke risks starting today. Reducing sodium intake is not about reshaping your entire life overnight. It begins with small, thoughtful choices that accumulate into significant benefits. One of the most effective ways is to reduce processed foods. These items often contain more sodium than homemade meals. Choosing low-sodium alternatives can also make a major difference. Many brands now offer versions of canned vegetables, soups, and sauces with reduced sodium content. Proper hydration plays a critical role. Drinking water throughout the day helps the body maintain stable sodium levels. Avoiding salty dinners is another powerful habit. When the body does not have to process extra sodium during the night, blood pressure remains more stable. Improving sleep quality by creating consistent sleep routines and addressing sleep apnea can also drastically reduce risks. Monitoring blood pressure consistently provides valuable insight into how your body responds to sodium. Keeping a simple journal of meals and numbers can reveal patterns that were previously invisible. Gentle exercise improves circulation and supports the heart in handling pressure changes more effectively. I have seen seniors transform their health by making these small adjustments. One patient reduced his sodium intake by switching to homemade soups and limiting restaurant meals. Within months, his blood pressure improved, his energy increased, and his stroke risks dropped significantly. These changes are not only possible, they are powerful. When to seek emergency help immediately, knowing when to seek help can make the difference between recovery and long-term disability. The signs of a stroke should never be ignored. Facial drooping, even if subtle, signals that the brain is struggling. Difficulty lifting one arm or keeping it raised should be treated as an emergency. Speech that becomes slurred or difficult to produce is another clear warning. It is important to act quickly. Calling for emergency help immediately can prevent lasting damage. Even if symptoms fade, the danger remains. Many strokes begin with minor symptoms that seem to resolve. But these early events are signals that the brain is at risk. The faster someone receives treatment, the better their chances of recovery. Understanding these signs empowers seniors to protect themselves. It offers a sense of control in moments that might otherwise feel frightening. It ensures that no one has to face uncertainty alone. As we come to the end of our time together today, I want to bring everything back to one simple truth. Your everyday choices shape your long-term brain health. The meals you prepare, the habits you nurture, the attention you give to your body each morning and night, all combine to create the foundation of your future. And the beauty of this truth is that small changes can create powerful protection, especially as we grow older. If you have ever felt a moment of unexplained fatigue, a sudden wave of dizziness, or that quiet morning weakness that makes you pause, I want you to trust those signals. They are not interruptions, they are invitations. Your body is speaking to you in the only language it has. These subtle messages are often the first hints that something deeper is unfolding inside your brain or your blood vessels, especially when sodium has been silently working against you. Many of my patients have told me they wished they had paid attention sooner. They believed the signs would pass. And sometimes they did. But the body rarely whispers without reason. When you choose to listen, you choose to honor your future. You choose to protect the moments and memories that matter most. I also want to remind you of something just as important. Every heartbeat and every breath is a gift worth protecting. Your body has carried you through joy, hardship, love, loss, and lessons. It deserves patience. It deserves care. It deserves your gratitude. You are stronger than you think, and your health is worth fighting for every single day. Thank you for joining me today. Take care of your body, listen to its early whispers, and stay safe. If this video helped you, remember to subscribe, like, and share the Senior Health Daily channel so we can continue supporting our senior community.